The Baptist Medical Center in the Northeast region recorded 16 deaths of preterm babies due to the absence of a neonatal intensive care unit. According to hospital management, neonatal deaths related to prematurity at the facility rose to 16 out of about 100 cases recorded last year. The hospital is also facing a shortage of specialists such as pediatricians and medical doctors. Consequently, the management has called for support for the construction of a neonatal intensive care unit to address the rising rate of preterm deaths at the facility.
The Baptist Medical Center, Nalerigu, considered as the Northeast Regional Hospital, is faced with several challenges that are hindering the provision of adequate medical services. The facility records an average of 80,000 and 100,000 outpatients and over 18,000 inpatients a year. Being a major referral facility, the hospital serves a large area of the 5 northern regions, and some patients come from northern Togo and eastern Burkina Faso as well. Among the numerous challenges facing the hospital is a lack of a neonatal intensive care unit to provide special care for premature newborn infants. Dr. Isabella Aisha is the medical director of the facility. She says the absence of a well-equipped neonatal intensive care unit is affecting the management of neonatal cases.
From January to October 2022, we have seen 590 cases that need neonatal intensive care, and then out of those cases, we had about 138 cases of prematurity, and out of the 138 cases, we lost 16 of them. Some of them, or most of them, arrived needing resuscitation and died in the process of resuscitation. They didn't continue on for long. Some came with bad sepsis. They had been kept away from the hospital for a while, and so they came with associated problems and died.
For more than 60 years, neonatal intensive care services at the facility have been ineffective, as all neonatal cases were managed with the mothers on the maternity ward due to the absence of a specialist and inadequate accommodation spaces. In a bid to address the challenge, the hospital management in November 2021, and with the support of Hamsley Charity Trust and UNICEF, designated this mini structure as the neonatal intensive care unit. Aside from the inadequate accommodation spaces for the patients, the facility operates with 6 incubators and 6 cots without monitors. According to Dr. Isabella, these equipment are woefully inadequate compared to the number of cases being received at the unit.
You can imagine the stress on the 6 cots and the 6 incubators that we have. The space is just so inadequate for our nursing staff. It's inadequate for mothers. We don't even have a place where mothers will rest awaiting the next feed. We still have a very long way to go in the area of expansion of our neonatal intensive care unit, in the provision of resting places for the mothers.
The medical director also expressed worry about the absence of a pediatrician and other specialists, as well as the shortage of medical doctors at the facility.
I would like to, not just for pediatric doctors to come, but any specialty. The hospital is a beautiful hospital. We are located in a region that has good potential to become better than it is right now. So I really do not see what the hitches are in my colleagues and senior colleagues to join us to provide services for our people out here. So if they can join us, I welcome them to join them, and I challenge them to do so.
On his part, however, the hospital administrator is calling for support for the construction and equipping of a new neonatal intensive care unit.
What we are praying for, and we are seeking the others to support us, is to help us to more or less get funds to put, we have the land, just put a new unit, completely unit for neonatal intensive care, so that we can be able to provide all the necessary equipment, necessary divisions, and then also get some place for the mothers to stay and to sleep.